Welcome to Advanced Practice, where we brew insights and evidence to elevate mental health practice. In this bonus episode, we focus on a critical part of ADHD treatment that often determines success or failure: managing side effects. Most side effects are not random. They reflect how a medication interacts with the brain and body, particularly in relation to dose, timing, and mechanism of action. When approached correctly, side effects become clinical data and not just problems to suppress. Let's start with one of the most common issues: decreased appetite. This is typically related to dopaminergic activity and occurs during peak medication effect. Instead of immediately lowering the dose, consider timing strategies. Encourage patients to eat a full breakfast before dosing and a larger meal later in the day when medication effect is wearing off. If weight loss becomes clinically significant, dose adjustment or switching formulations may be necessary. Another common issue is insomnia. This is often not just a side effect, but a timing mismatch. If medication effects extend too far into the evening, sleep will be disrupted. Management may include earlier dosing, switching to a shorter acting formulation, or in some cases, using agents such as clonidine or guanfacine to support sleep and reduce hyperarousal. Next is irritability or emotional rebound. This often occurs as medication levels decline and is sometimes misinterpreted as worsening ADHD. In reality, it is frequently a wearing off phenomenon. Management strategies include adding a small afternoon booster dose, switching to a longer acting formulation, or smoothing pharmacokinetics with alternative delivery systems. Another important side effect is anxiety or jitteriness. This may indicate that the medication is too activating for the patient, particularly with amphetamine-based stimulants. Options include dose reduction, switching to methylphenidate, or considering a non-stimulant medication such as atomoxetine or guanfacine. Headaches and gastrointestinal discomfort are also relatively common, especially early in treatment. These often improve over time, but can be minimized by taking medication with food, adjusting the dose, or slowing titration. We also need to monitor cardiovascular effects, including increases in heart rate and blood pressure. While typically modest, these changes require baseline assessment and ongoing monitoring, particularly in patients with pre-existing cardiovascular conditions. Another concern is tics or tic exacerbation. Although stimulants do not consistently cause tics, they may unmask or worsen underlying tic disorders in some patients. In these cases, consider dose adjustment, switching classes, or using alpha-2 agonists such as guanfacine or clonidine. Finally, always consider overmedication. If a patient appears emotionally blunted, overly focused, or socially withdrawn, the dose may be exceeding the therapeutic window. The goal is not maximum focus. It is functional improvement with preserved personality and flexibility. Across all of these scenarios, the key principle is this: do not treat side effects in isolation. Instead, ask 3 questions. First, is this a dose issue? Second, is this a timing issue? And third, is this a medication class mismatch? When you answer those questions correctly, management becomes more precise and often simpler. That is how side effects shift from being barriers to becoming tools that guide better prescribing. And that's all for our ADHD series. Follow us here at Advanced Practice. For California nurses, CE credits or CEUs are available at www.advancedpractice.io. See you next series.